Hello, good morning. Compliments of the season. I believe you're celebrating very, very safely. All right. So today I want to talk about something. It just came to my mind and I just decided to talk about it because most of the time we have new mothers, people who just put to bed for the first time, or maybe who are just having those who are just having a male child for their very first time in their lives. And, a time comes when they have to go for circumcision. And, there are several traditional practices that most women embark on during this period of circumcision that is very, very bad and unsafe for the child. Now, I have heard sometimes where parents who have boy children, they go to traditionalists and they do their circumcisions and they give them some dung and all of this to apply on the area and all of that. Now, traditional practices around male circumcision can be very harmful. It can actually lead to a lot of complications, and that is why I want to talk about this today. Now, before I start, I want to give a simple definition of what circumcision is about. Now, what circumcision is that in the male organ, I don't want to mention the name so Facebook doesn't look at me as a bad person, and I don't want my page to have issue. The male organ, at the tip of it, there is a foreskin that covers the tip of the male organ. So during circumcision, what happens is that the qualified health caregiver removes that foreskin carefully. It's a simple surgical procedure. You understand, that helps to remove that foreskin that covers the tip of the male organ. And it's usually done when the child is still very young. Is more safer and better the first 2 months of life. You understand? Most of the time, you can actually do it after 2 days of birth or within few days, and it is also good. But most times, it can be delayed. Some medical professionals may advise that you hold on for your baby's circumcision, maybe if the child is preterm or has a very low birth weight. So that is why I always encourage that if you want to have your child, it should be in a health facility where you have qualified hands to cater and to care for you. Now, during the circumcision, why I said it is good for you to take your child to the hospital, to the healthcare facility for the circumcision is because, when a qualified person handles the circumcision, it ensures strict hygiene. It ensures proper pain management and even correct technique. There is a technique we use as medical professionals to remove that foreskin. For example, you do it wrongly. For example, maybe the right technique wasn't used during the circumcision. It becomes a problem. It can lead to complications. So please, when you have your child, is a boy, when it is time for circumcision, the hospital will let you know the proper time that you should come for circumcision. Please ensure you obey these instructions and get your child circumcised in a health care facility by trained hands. Don't go to roadside or all these traditionalists for them to handle your child's circumcision. We've seen cases of, severe complications where the child almost died and some even died, maybe from excessive bleeding or infection or maybe damage or injury to the organ. And it is a bad one. So if you are watching me now, you have a friend who just gave birth to a male child, or you have a male child just recently, please ensure you follow the regulations or the instructions from the healthcare providers. Get your child circumcised in a health facility under a trained hand so that you avoid complications. Now, when you go to all these unsafe places for the circumcision, the environment is unsterile, hygiene poor. You expose your child to infection. You expose them to complications, excessive bleeding, even injury to the organ, and that will be a very bad one. Now, what happens after the circumcision? Majorly in hospitals, we always educate the mothers when they come for circumcision. After the circumcision, we tell them what to do and what not to do when they get home. Now, I want to be giving you some of the things you need to do as a mother when you get home, when you are discharged from the hospital after your child's circumcision. The only thing you need to do is that you should ensure that that area is always clean and dry. Sometimes in the hospital, there is a particular ointment that we usually, that a medical doctor or the doctors will prescribe that you should be applying to the area where the circumcision was done. Make sure you follow the instructions. Apply it. How many times did they tell you? Do it. If it is 2 times, if it is once, ensure you follow the instruction and apply it accordingly. And please avoid using, sometimes, mothers will get home, they will say, my mother say, my mother-in-law say, and all of that. And they'll start pressing very hot water on that area. No, nobody asks you to do that. That is why I said, follow the instructions of the healthcare providers. Keep the area clean. Apply the ointments. If any drug was prescribed, give to the child. And then make sure you don't use the diaper. Don't put the diapers to be too tight. Don't wear tight clothing that will be rubbing around that area where the circumcision was done, so that it doesn't irritate the place and doesn't cause more pain for the child. And also regularly change the diapers, especially when the stool can actually come in contact with the wound area and can irritate it and all of that. So please regularly change the diaper and all of that. And when you get home, after circumcision, we encourage you to bring a new diaper and put for the child. What that means is that when you get home, you could check the diaper. If you notice maybe blood in the diaper is too much, you can quickly rush back to the hospital. And now, why it is good for you to carry out this circumcision in the hospital is that when there is any complication, it will be properly handled. But if you are going to all these roadside people, traditionalists and all of that, they don't know how to manage complications. They don't know what it means. They don't know techniques involved in doing anything. They just do it blindly. And that is the essence of you getting care from professional hands, especially when it comes to your health. Health is wealth. And children are very tender. And a little mistake can actually cost their lives. And you need to be very, very careful to avoid complications. As mothers, we need to be very, very meticulous when it comes to things we do for our children and with our children. So this is about circumcision. And if you have someone who just had a baby boy, or maybe they've had girls and they just have a baby boy for the first time. Like me, for example, I have 2 boys. The first time my son had his circumcision, it's usually a very emotional moment. Like myself, even as a medical worker, a professional nurse, I I cried for my first son when they were circumcising him in the hospital, and it was very, very funny for me. So it's always a period of emotional drama and all of that, but your child will still be fine, and it is what makes them become a better man. Sometimes some people don't do circumcisions for their babies, and they will say maybe when the child grows up, they will decide to go for circumcision. Yes, there's adult or adolescent circumcision, but that one is on another day. I'm just concerned with the baby circumcision, baby boy circumcision. And I want to remind you again that female genital mutilation is very prohibited. Do not circumcise your female child. It is very, very risky and dangerous. You could tamper with their reproductive health. Please don't do that. Circumcision is only advised for male children. It is only advised for male children. Don't try it with your girls so you don't cause them trouble. All right, this is what I have for you today. I know we are in the season of festivity, but every day people give birth. So this health talk is timely. All right, have a good celebration, and I wish you a prosperous new year and a safe celebration. See you next time.